Members, we're moving to Senate third reading. The first item of the day is file item 53, which is Senate Bill 866 by Senator Wiener. Secretary, please read.
Senate Bill 866 by Senator Wiener, an act relating to minors.
Senator Wiener is ready. Senator Wiener, you're recognized.
Thank you very much, Mr. President. Colleagues, SB 866 will allow teenagers aged 12 to 17 to protect their own health by getting vaccinated. And of course, limited to vaccines that are approved by the FDA and that meet the recommendations of the CDC Advisory Committee on Immunization Practices. SB 866 builds on long-standing existing California law that allows teenagers to make certain medical decisions for themselves. Under existing long-standing California law, teenagers can receive the HPV vaccine and the hepatitis B vaccine on their own, in addition to any other sexual health treatment. Teenagers on their own can seek and obtain treatment for mental health conditions, for domestic violence and sexual assault, for drug and alcohol-related disorders, and for other conditions. Right now, we trust teenagers to make those decisions for themselves. Minors of any age can consent to birth control and abortion. Yet, a teenager today cannot go in and get a flu shot unless their parents consent. Even if a teenager desperately wants a vaccine, wants to protect their own health, right now they cannot do so on their own. And we know that there are many teenagers that want to protect their own health and they're unable to do so, whether because a parent doesn't believe in vaccines and is prohibiting them from protecting their own health, or whether because of medical neglect, and we know that there are all too many children in this state who are suffering from medical neglect, or because a parent is simply too busy to get around to it, or it gets delayed. And then it's that teenager's health that is on the line as a result. There are other states, we will not be the first. There are other states that allow teenagers to go and get vaccinated on their own, including Rhode Island, South Carolina, Oregon, Alabama, and Washington, D.C. This is not just about COVID. I know that is what's front in mind for all of us, obviously, but this is about any vaccine that is recommended for this age group. We know that measles, tragically, we thought we had eliminated it in the US. It's back. We know that mumps is still around. We know that even polio, which we have eliminated in this country, is still circulating in various parts of the world and could come back to the US if the vaccine misinformation and hesitancy continues. And this is about allowing these young people to take steps to protect their own health, and we should allow them to do that. Nearly 1 million California teenagers are not vaccinated against COVID-19. And we could talk about other vaccines as well. Large numbers of teens who are not vaccinated, many of whom would like to get vaccinated and would do so if we recognized their agency and their autonomy to do so, which is what this bill does. Colleagues, I respectfully ask for an aye vote.
Thank you, Senator Wiener. Senator Nielsen.
Mr. President, ladies and gentlemen of the Senate, this is but another of the continuum of legislation to undermine parental authority and parental responsibility. Parents should always be involved in decisions about their children, particularly the youngest, and this is of that class. I don't understand why agencies, entities, decide they know better than the blood bond of parenthood. It's a concern to me greatly for American society that we continue to undermine the authority and the ability of parents to control and input decisions of their more minor children. 17, yeah, that's getting on its way to maturity, but you're not there yet. And it does not serve us to continue to take away that responsibility and that opportunity for the blood bond parents of our youth. I urge a no vote.
Thank you, Senator Nielsen. Senator Newman.
Thank you, Mr. President. I rise today as a co-author of SB 866. As we continue to deal with the increasing politicization of the COVID-19 pandemic, this bill is a sound and sadly necessary public health measure. As my colleague from San Francisco has already noted quite clearly, the measure before us applies to vaccinations generally and will not force teens to get vaccinated. Rather, it empowers young people over 12 years old to avail themselves of the eminently sensible option of protecting their own health as part of being responsible members of their communities. We have ample proof that many young people are smart enough and fully capable of making informed and intelligent decisions. And while we should always grant deference to families in the complicated and personal business of raising children, we should not, in the midst of this challenging and precarious time, allow the political or religious views of someone's parents to stand in the way of that person protecting his or her own health and the health of others. In this moment, indeed on this day on which Americans bear witness to the incredibly sad and unnerving milestone of over 1 million deaths in the United States caused by COVID, this measure could not be more timely or more valid. And notwithstanding all of the politics and polarization of the pandemic, it is a fact that the vaccines developed against the SARS-CoV-2 virus and its variants and subvariants have been scientifically and thoroughly proven to protect people from severe outcomes, especially from dying. Moreover, and just as importantly, at this point there is comprehensive evidence that COVID vaccines are safe as any of the other life-saving immunizations to which we owe a great deal, a debt of gratitude for the safeguarding of public health and the steady extension of lifespans in our modern society. The more Californians who have access to these life-saving vaccines, the sooner we can put the pandemic fully behind us. Empowering young people with access to COVID vaccines is essential to keeping students in school, not only for their education, but also their physical and mental well-being as well. I commend my colleague for bringing forward this measure. I stand proudly with him, and I respectfully urge your aye vote this morning.
Thank you, Senator Newman. Senator Pan.
Thank you, Mr. President, Senators. I rise in strong support of SB 866 as a pediatrician and a father of 2 children, one of whom is a teenager and another one who will turn 12 actually later this year. This bill is important to allow young people to self-consent to FDA recommended and ACIP recommended vaccines. And as a pediatrician, I know how important it is that young people are capable of making decisions about their own health care. And it is up to this legislature to allow them to do so. Now, certainly heard testimony about parents, and in fact, as a physician and someone who particularly focuses on taking care of children and our youth, of course we engage parents. We always try to engage the parents. But we also know, unfortunately, there are circumstances in which, and it is truly unfortunate, as a physician who's had to deal with child abuse and neglect and so forth, that sometimes parents don't always act in the best interest of their children. But actually, even more importantly, oftentimes parents are trying their best, but they may be, for their circumstances, they may be away, right? There may be different family arrangements and so forth, and those become barriers to the youth getting care. So we certainly try to engage the parents, and the parents try to engage with us. But, so for example, you have a migrant family, and the parents happen to be working in another county or they're farther away. They can't get there. And meanwhile, their grandparent, or maybe an older sibling or an aunt or uncle are the ones primarily taking care of them, but yet they don't have the legal authority because there wasn't, they didn't go to court or anything like that, because the parents, they'll eventually come back, et cetera. So these become barriers to care. And certainly, I think while some people view this bill as a situation in which, for example, maybe a youth and a parent may disagree, Actually, as a pediatrician, I'll tell you the more common circumstance is that the parent actually agrees, but they were, again, they're maybe working 2 jobs. They may be in a circumstance where they were not able to accompany the child. And in fact, for example, what happens when actually the child, you worked with the parent and they got their first vaccine, because many vaccines are a series, and then they come for a follow-up visit, but because the parents are too busy with their jobs or other circumstances, they're brought by, let's say, an older sibling who happens to be, 20, but doesn't have, or their grandparent. And then the problem is they show up in the office, and I've seen this so many times, and then we're like, sorry, we can't do this because we don't have the parent here to give direct permission. And we try to reach the parent, but they're working, they don't have, they don't have a phone where they're at. We certainly know workers where they don't allow them to keep cell phones next to them, et cetera. And we can't reach the parent, we go, sorry. And meanwhile, the family certainly took tremendous efforts to be sure their child could come and get care, and unfortunately that hasn't. I would also keep in mind that while certainly in this circumstance we're talking about allowing teens or youth to self-consent, that in order for them to get the services, there's actually a licensed healthcare professional has to deliver it and has to exercise their own professional judgment that it's appropriate for that youth. And I think that's another layer of protection to ensure that, certainly it's not that the youth can decide I want anything I want. There's actually a licensed healthcare professional says this is appropriate for you. And I would also point out that this bill is particularly focused on, again, vaccines which have gone through the most rigorous testing and requires approval and recommendation from experts like the Advisory Committee on Immunization Practices. And that's why, by the way, in addition to what this bill addresses, just vaccinations, that already in California law, if a 12-year-old shows up in my office, and not only if they want other vaccines like HPV and hepatitis B, they can consent to it, they want to talk to me about an STD, drug use, their pregnancy, sexual assault. I don't need to go ask the parent because we know that it's important that those youth get the care, and they also have the privacy necessary to do that. And by the way, it also includes mental health issues, thinking about all the mental health issues we're struggling with right now, and unfortunately the stigma attached to that. So this bill really is about reducing the barriers to getting life-saving vaccines. And certainly there's no medical or science-based reason why minors 12 or older should not be able to consent to them. So again, as a pediatrician who studies child development, there's no reason to think that a 12-year-old by law should be able to consent to them. And certainly again, with a licensed healthcare professional who's evaluating their state of mind and their condition. I will point out that many of the people who oppose the Teens Choose Vaccines Act also oppose abortion access. And the California legislature must hold the line against fighting against agency for women and young people. For that reason, the age consent to vaccines must be 12, which is what it currently is now. We do not know the consequences for abortion access if we start making decisions for political reasons and not scientific ones. So this really is about making it easier for young people to get vaccines, which should be a good thing. And we also want to increase healthcare equity because, again, it's usually the families that are most disadvantaged who have the largest barriers to getting vaccinations, including, by the way, getting this consent. So whether it's time off work for a wellness visit or forgotten paperwork, any change that makes it easier to get vaccinated is the one we must take. And we, of course, know how important vaccinations are in order to protecting the child's health, being sure that they can go to volunteer in a hospital, visiting high-risk family members, right? I mean, parents often want their children to get it, so protect other people in their family. So this is, again, very important to ensure we have appropriate access to life-saving prevention for children. And with that, that's why not only, of course, am I speaking in favor of it, my colleagues in my profession are. So you don't have to listen to this one pediatrician here who happens to be among you. The pediatricians of California stand for this across the board. Young people want this. Young people across California want this. This SB 866 also authorizes bodily autonomy that they are capable of. The Teens Choose Vaccines Act is an important tool that we need to reduce the barrier to vaccinations. I respectfully ask for an aye vote. Thank you.
Thank you, Senator Pan. Senator Borges.
Thank you, Mr. President. You're doing a fine job today, I might add. Thank you. Colleagues, this is certainly a difficult issue. But if we were to go back in time when we were going through the first year of COVID, and certainly into the second, we were trying to figure out what we were going to do in terms of vaccine policy. I consulted with my family doctor, I consulted with my family and friends. And I personally believe that the vaccines were the best path forward for me and my family, and specifically my two young boys, aged 10 and 8. This bill, I believe, is going to have many unintended consequences. The first of which, what is the role of the parent? And what is the legal age of majority? What does that mean? Because as we've heard before, that you can be 12 years old to get certain medical treatment, but you'll have to be a different age to vote or serve in the military, and yet another age to buy alcohol or smoke cigarettes. Somewhere between 12 and 21 is the age of majority in California. We just can't figure out which one we want and which one's most applicable. But for this particular bill, my concern is that we heard in judiciary people call in, and we also heard from our esteemed physician, also a member of this body, that this is going to make life easier because a lot of times these individuals, these children, can't get parental permission because maybe the parents work outside the area, or they're busy, or it's a single mom working 2 jobs. That entire scenario can be resolved administratively by having a sign-off program that authorizes the parent to still make the decision in the best interest of the child, and the child be given access to the vaccine. So let's not kid ourselves that this is the only way forward on this issue. Parental consent can be given, and it can be expedited in an administrative fashion. But I haven't heard us talk too much about that. I've also heard that this issue is about following existing legislation. Well, if that is the rationale, it's hard not to imagine that existing legislation wasn't deliberately put into effect for the very purpose of opening the door for subsequent legislation. So I have an absolutely hard time trying to reconcile this, because if we continue down this path, I imagine a year from now or 2 years from now, this same issue of 12-year-old consent will somehow find its way into clinical trials. Right now, it has to be FDA approved. But in 2 years from now, it's only a matter of time before certain pharmaceutical powers and interests wanting to build up a body of scholarship in a certain area are going to want to make certain that clinical trials can be achieved by the consenting principal who happens to be 12 years old. As a parent, this is deeply troubling to me, and as a parent who believes in vaccines, I don't think this is the right path forward, because I think you can achieve the majority of what your constituents in call-ins and colleagues have said. This can be done administratively. And I don't think we've spent enough time on that issue. And so I guess I will conclude with this, colleagues, that for those of you who are parents or have legal guardianship over children, you have certain responsibilities. You are expected to oversee and take agency of that minor. This law and the entire cadre of associated laws that are making legal consent the age 12 is doing away with all of that. So as a parent, you have full legal responsibility, but you have no parental authority. This is a dangerous path forward, and as parents or those who are grandparents in this room, I think you should look upon this on a personal level, what the implications of this will mean today, but tomorrow and the years to come.
Thank you, Senator Borges. Senator Melendez.
Thank you, Mr. President. Ladies and gentlemen, I rise in opposition to this bill. There was a comment made that there is no medical reason for this not to be law, and I wholeheartedly disagree. Johns Hopkins, since April 2021, have reported there have been more than 1,000 cases of myocarditis and pericarditis in children happening after the COVID vaccination. I would say that's a very good medical reason. Not to mention the medical reason for when a child might have some underlying medical issue or perhaps is taking some other medication that might cause an adverse effect after getting a particular vaccination, and that minor child not telling the person administering the vaccine that they're taking that medication or that they have that family history or that they have that particular medical condition. If you're talking about a 12-year-old, I mean, many of you in here have kids. Some of you still have kids in the home like I do, and you know that kids that young have difficulty remembering a lot of things, let alone any particular medication or medical illness, that they may have that they would need to divulge to the person administering the vaccine. Not to mention, if this minor child goes and gets this vaccination and doesn't tell their parents, how in the world is a parent supposed to be able to recognize that something is going wrong after getting that vaccination? How would a parent know that that's what it is caused by and then know how to seek the proper medical care? Particularly if, as many have pointed out, there are parents who are just too busy to take their kids to go get vaccinated. Well, if the parents are busy and working and not there to see that there's some sort of adverse reaction, how are they going to help them? If the parents don't know that the child got the vaccination, how would they know to even keep an eye out for it, to watch for it? If they are at their second job, maybe perhaps tell an older sibling or their caretaker, hey, keep an eye out for any of these sorts of symptoms in my child. They wouldn't know that. They wouldn't know that. And I think that is unfair and unreasonable to do to a child or to any parent out there who just wants to keep their child safe, irrespective of whether or not they believe in any particular vaccine, because there has been a lot of discussion about this being about the COVID vaccine, but this bill doesn't relate only to the COVID vaccine, although I think that's largely what has dominated people's minds at this point. The other issue with this bill is I'm not entirely sure that it's legal. The National Childhood Vaccine Injury Act states each healthcare provider who administers a vaccine set forth in the vaccine injury table shall provide to the legal representatives of any child or to any other individual to whom such provider intends to administer such vaccine a copy of the vaccine information statements supplemented with visual presentations or oral explanations in appropriate cases, and that has to be administered prior to giving the vaccine. So if you give a minor this vaccination and you hand them the booklet of all the different adverse reactions that may take place, do you trust that that minor will read it? Do you trust that that minor will give it to an adult in their life who may be watching over them, that they will give it to them? Probably not, particularly if their parents or their health or their provider, whoever's taking care of them, doesn't even know they're getting it. This puts children at risk. I know there are people in this room who firmly believe that every child should get this vaccine, whether it's the COVID vaccine or any other. I understand that, but I think you're not looking at the reality of the situation, which is this could actually cause very serious harm to children. There is a reason that there is a database that tracks adverse reactions to vaccinations, not just the COVID vaccine, but all vaccinations. There's a reason for that, and there's a reason there is a fund that has been set up that has paid out nearly $5 billion to those who have been injured or died from the administration of a vaccine, almost $5 billion. Why is that? Because these things do happen. Largely, vaccinations are administered and there are no serious side effects, but guess what? There are many other instances where there are. So I am asking you to please consider the health of these children. Please consider that you are putting parents in a terrible situation where they would have no idea that their child might be having some sort of reaction to this vaccine and have no ability to help them because they don't even know that it's going on. I urge a no vote.
Thank you, Senator Melendez. Senator Ochobo.
Thank you, Mr. President and members. I'm taking a full breath because I want my adrenaline to come down. My heart's beating so fast right now. And we had some notes because I knew that I would get really riled up, and I want to be frontal lobe thinking and not primal in my brain of trying to express my thoughts this morning to my colleagues who I wholeheartedly respect. While I believe that vaccines are an important public health tool that we have and encourage all to consult with their doctors and consider getting vaccinated, I rise today as a parent with strong concerns about the implications of this measure. This bill would empower vulnerable populations of children to consent to medical treatment that they likely know little about without the guidance or knowledge of a caregiver or parent. At 12 years of age, a child's brain is still forming, and their reasoning skills are not always fully developed. I think we can all agree on that. A minor is any person below the age of adulthood who is still legally under the authority and supervision of their parents. Do we hear that? A minor. Legal definition. An emancipated minor is one who has proven to the court that they are mature enough to make their own decisions, manage their finances, and that emancipation is the best path for them. Parents and guardians know their children best, which is why they are currently required to furnish information about the child's medical history, prior allergic reactions, and overall well-being. Personally, I didn't know I was allergic to penicillin because of the reaction that I had as a baby until my mom told me later on as an adult. Parents are also required by federal law to be provided with significant paperwork regarding side effects to each vaccine, how to detect signs of adverse reaction in children, and emergency protocols. Under this bill, if a minor child consents to vaccination without parental knowledge and has a reaction, the parent may not recognize the vaccine reaction symptoms, which can put the child at further risk. All of these reasons why vaccine decisions should be made between parents, children, and a healthcare provider. This bill is one of many that we have seen seeking to remove the important role of parents. As a strong believer in the power of the family unit, I urge all of us to consider the broader implications of the decisions we make here. As we are making decisions that empower healthy families to make the decisions that are best for their families, or we are mandating from the top down what we think is best. I'm going to go off script right now, and I'm going off the heart right now. I've been here only a year and a half, not very long. But I've seen and I've been listening carefully to what my colleagues have been stating here. What motivates your bills, what's in your heart, and sometimes what motivates your bills. Sometimes we get myopic. We focus on one particular bill and the merits of that bill. And I can see that sometimes we vote because it sounds warm and fuzzy. It's something that, okay, it sounds really good. But here's the thing, colleagues. Coming from out there into here, sometimes the implications of the bills that we have an impact that doesn't come right away, but it comes 10, 20, 30, 40 years from now. And what do I mean by that? I heard once from one of my colleagues that we can't legislate values. But let me reassure you that what we legislate becomes our values, or a reflection of the values that some of us have. A vote today on this bill a no vote, let me just clarify. A no vote on this bill does not implicate the fact that we don't believe in vaccination, as they are readily available now to anyone who chooses to be vaccinated. It's not a matter of cost, because it's readily accessible. California legislature, the governor, has made it possible for that to happen, for anyone to have that capacity to make that choice. But a no vote on this bill today means that you believe that the parent fundamentally, or the caregiver fundamentally, has the ability to seek the resources and make decisions that is best for their child and their family. We are empowering them, not disenfranchising a parent or a family. The most fundamental unit of any society. We know that healthy families are fundamental to a healthy community, a healthy society, a healthy state, and a healthy country. We know that. But when we pass legislation where we take away the parent's ability to participate in their child's upbringing, well-being, what values are you promoting and conveying? That's what a no vote or a yes vote will mean on this. Not the fact that their vaccines are not available, because they are, to everyone and anyone who chooses to have them. The other thing I wanted to mention is that moving forward, the notion of a precedence, because we've done it before, where minors could get a vaccine, doesn't make it so that this is okay. That just makes it that we're furthering, stripping away, chipping away at a parent's responsibility and ability to parent. I hate to say this, but government can only provide the framework in which people can choose to pursue life, liberty, and happiness. When we start overreaching and mandating and telling people what they can and cannot do, colleagues, let's rethink where we're going. Where are our values pushing us to? To the point where we say parents are no longer necessary. Just a couple of months ago, the Sacramento Bee had an article about the reading scores of California being at the very bottom across the state, in comparison to across the state. And you know what one of the suggestions that they had on that article? What would make an impact and a difference in that? Parent engagement. Parent engagement would make a significant impact in our reading scores. So you see, as a body today, will we empower parents with resources and the ability, the autonomy to make decisions and bring harmony to that family? Or will strip that right away? Colleagues, be visionaries in your legislation. Be visionary in the way that your values will be manifested based on legislation moving forward 20, 30, and 40 years from now. Once again, a no vote today does not mean you're anti-vaccine. It just means that you believe that parent involvement and engagement is crucial in making an impact and a difference in a child's life. I respectfully ask for a no vote.
Thank you, Senator Ochoa Bogue. Senator Kamlager.
Thank you, Mr. President. You know, I was not expecting to raise my microphone on this bill. I wasn't even expecting it to come up. But I've been listening to the comments on the floor, and I have been thinking about them as a parent and listening to all of the ones who have raised their microphone or who have shared, you know, their thoughts on this legislation and where we are in this time as a parent or as a guardian. And I'm going to just be honest with you. You know, as a parent, I want to have total control over everything in my household, including my children. I want them to ask me all kinds of questions. I want to be the one giving them all of the answers. I want all of the answers to be correct. And when they are not, I want to have the ability to go back and find the right answer and come back and give it to them. That is a fantasy. That is a fantasy. I have not been thinking about vaccines in the context of 866, I have to tell you. And I am not thinking about other parents like me who have the best interests of their children at heart. I am thinking about other parents and guardians out there who do not, who are absent, who are neglectful, who are abusive, who are harmful. In fact, I was thinking about the parent arrested this week for killing her children. I was thinking about parents who are anti-gay, who have a child who is LGBTQIA, and how they punish them for being gay, refuse to share information or access to resources or supports or to acknowledge that they exist. None of that has anything to do with vaccines for sure, but it does acknowledge that there are all kinds of parents out there, and some are amazing. All of us fail. Many of us fail with really great intentions at heart. And there are some that are not looking out for the well-being of the children in their lives. I completely agree. Parental responsibility and legal authority, there should be greater connectivity. Because I can tell you so many examples of why I feel like, why am I responsible for all of this? And the child just wants to do the whole thing, but maybe I'm just caught up in the madness of having a teenager at home. But I do think we have a responsibility to legislate safety. And I think we have to be honest about all kinds of parents that are out here. And some really do need legislative circumvention like this. I'll rephrase that. The parents might not need it, but the children deserve it. Because I will tell you this, young people know when they are in trouble. They know when they are in harm's way. They know that they are with a parent or a guardian that is not loving them. And they don't have the resources that we know they should have to help them navigate through their young life safely. And when it comes to having access to medicine that will keep you safe, just like it when it comes to having access to resources that will keep you alive, that will protect you, we have a responsibility to talk about those instances and find a way to create policy that will help those children. So I am not thinking about 866 in the context of my family, because we do have space at the table for honest, uncomfortable, open discussions where we're trying to figure out how to create a path where the whole family is on board. I'm not thinking about those families. I'm thinking about those families where children are at risk and the parent or guardian that should be looking out for them is not, is intentionally not. And how do we help them? So I respectfully ask for your aye vote on SB 866.
Thank you, Senator Kamlager. Seeing no other members wishing to be recognized, Senator Wiener, you may close.
Thank you very much, Mr. President. Colleagues, thank you for the debate. I appreciate it. I do just want to say one thing with all respect. This is not a warm and fuzzy bill. We have bills on this floor. We could all probably name a few. Some of it, we've all probably at one point or another authored a bill that is warm and fuzzy, that is just like a feel-good bill. It was a good bill, but is not going to change the world. This is not one of those bills. When you talk about a teenager who is either being blocked by their parent from protecting their health, or is being neglected or abused and can't protect their health, when that teenager is simply saying, I'm a teenager who is immunocompromised and doesn't want to end up on a ventilator, a teenager who doesn't want to get the mumps and become sterile, the parent's not going to become sterile, that kid's going to be sterile for the rest of their lives. A kid who, God forbid, polio comes back to this country, because as I meant, it is circulating in the world. If polio comes back, a kid who doesn't want to be paralyzed because their parent spent too much time on YouTube or Fox News and is preventing the kid from getting vaccinated, it's about those kids being able to protect their own health. We've heard some parades of horribles today about FDA clinical trials, which isn't even a question of state law, that's federal law. We've heard about myocarditis and side effects. But we have that other parade of horribles about kids actually getting sick and dying, not just from COVID, but other diseases that are 100% preventable, but for the parent not allowing the kid to protect themselves. We've heard about health history. Like, no kid knows their health history. A lot of kids do know their health history, and they know what pills they're taking. And doctors or pharmacists or other healthcare professionals, these are people who have gone through intensive training, knowing what questions to ask, what warning signs to look for, and how to make decisions and who can give informed consent. These are healthcare professionals, not just random people. And colleagues, I just want to say, of course we want parents to be involved in their kids' health care. Absolutely, we want parents to be involved. Of course we want kids to feel comfortable talking to their parents about vaccination or hundreds of other important issues in life. We absolutely want that. But as the senator from Los Angeles very eloquently stated, that's not the reality of the world for every child. And there are far too many children who can't talk to their parents for whatever reason, or they fear that they're going to be abused if they talk to their parents about it, or their parents just won't listen to them. And for those kids, they should be able to protect their own health. That's what this bill is about, and that's all that it's about. For vaccines that the FDA has determined are safe and effective, and that the CDC has determined is appropriate for this age group. I respectfully ask for an aye vote.
Thank you, Senator Wiener. Secretary, please call the roll.
Allen, Archuleta, Atkins, I. Bates, Becker, I. Borges, no. Bradford, I. Caballero. Cortese. I. Dally. Dodd. I. DeRosso. I. Eggman. I. Glazer. I. Gonzalez. I. Grove. Hertzberg. I. Wesso. No. Hurtado. No. Jones. No. Camlogger. I. Laird. I. Leyva. Limon. McGuire. I. Melendez. No. Min. Newman. I. Nielsen. No. Ochoa Bogue. No. Pan. I. Portantino. I. Roth. Rubio. Skinner. I. Stern. Umberg. I. Wachowski. I. Wiener. I. Wilk.
Please call the absent members.
Allen. Archuleta. Bates. Caballero. Dally. Grove. Leyva. Limon. I. Min. Roth. Rubio. Stern. Wilk.
Ayes 21, noes 7, the measure passes.